You are watching the DocTalk show. In our future story today, we bring you a bubbly Twinomogisha Juliet, whose ordeal going through the rather painful chemotherapy treatment has not robbed her of her joy one bit.
Twinomogisha Juliet is my daughter. It was last year when she started suffering of this disease, and I did not know it before. I came to the doctor, and it was in November, because this disease, this sickness started a long way back in time, like still last year around June, but I came to know of the real sickness when she was referred to this institute, Uganda Cancer Institute, for further management from Zambia Hospital. And it was in November, I think 23rd November, when she was diagnosed of a Williams tumor, which is an aggressive cancer. Since then, she started on treatment from this institute. But ever since she started treatment, I'm seeing some positive response as per the sickness is concerned. Before we started, she had a swollen stomach, and on the other right side of the kidney was also swollen, but now I can see some improvement. As you can see, the stomach is not swollen, meaning that there is a great improvement. Because when she was brought here, she was put on treatment, but the treatment was to go in phases. That is, she was to start with the chemotherapy treatment, and then after, she was to go under surgery, then radiotherapy, as she goes on with chemo, not until they see that it's now fine. But as per the doctors told me that it is a curable disease. It is curable, because that's why I got courage, and I still have hope that my daughter shall be fine. So here she is, and you can see she's doing well. Most of the people, they know cancer as an incurable disease, but I would like to appeal to them and to tell them that cancer is curable as per the research is concerned, and as we were told, because we were told that cancer, more especially cancer for children, is curable, because children are still young and their cells are still growing. So in case you suspect of the child to be having cancer, you endeavor to rush to the medical personnel, and don't remain there with children. In case you see a disease on a child that you don't understand, and sometimes you try to treat the disease and it persists, so you better rush to the major hospitals for assistance and guidance. So as I'm seeing my child is doing better, and I'm having hope that she shall get well in few time, because they told me that its treatment is lengthy, but it is between 8 months to a year. But I'm having hope that she shall get better.
You are watching the DocTalk show.
So, cancers are a very devastating illness in children. We looked at leukemias, which are the most common. They're quite aggressive. The good news is there is treatment available at the Cancer Institute free of charge, and children can be cured of some of these leukemias. How about the other common cancers in children? That's what we want to understand more. If they are equally curable in the first place. And if there are some signs, some warning signs people can learn to know that this cancer might be developing. So, Dr. Joyce, so are there ways in which these cancers can be identified, some warning signs, and what should parents do about them?
Okay, so of the other really common cancers, I want to start off by talking about cancer of the kidney, which is very common. It's in fact among the most common cancers that we see among children. The kidney lives somewhere in the abdomen, and the way the parent the most common way in which it is detected is by a parent or a grandparent or a childminder who feels a painless mass for the most part while they are bathing the baby. So a mass
They feel
in
something
the
in
abdomen.
the stomach of the baby.
They feel something in the stomach of the baby, and usually it is not painful. Once in a while, they may report an episode of urine that is red, not very common. So once you feel a mass in the abdomen for whatever reason, please just bring that child to be investigated for the possibility that they may have cancer of the kidney in the abdomen.
Okay.
The other cancers I wanted to talk about are the lymphomas, those that arise from the lymph nodes. And again, they are also masses. Remember, the lymph nodes are all over the body. They could be in the neck, they could be in the armpits, they could be in the groin, and other places. And lymphomas would present as swellings in these areas. I'm not talking about small swellings that are half a centimeter. I'm talking about a swelling that keeps increasing in size. And they are
Keeps
usually
growing and growing.
painless. So usually, sometimes when you cut your finger or you cut your toe, you may get a painful swelling on one side of your body, in the groin. It's usually painful and there is fever. And when they give you antibiotics, it normally goes away. Swellings that are painless, are increasing in size, and have not responded to a course of antibiotics are ominous.
They're very
And
suspicious.
should be investigated. Even if it's a TB swelling, after 2 weeks of therapy, it should go away. Many times in this country, people treat such swellings, especially if they're in the neck, as TB. If such a swelling was due to TB, within 2 weeks, it should show signs of going away. So if it is not
So
going,
if the swelling persists in the neck or in the armpits,
yes,
it's
in
not
the
going
groin
away
area,
with antibiotics, highly
it
suspicious of these
must be
lymphomas.
investigated as a lymphoma. And the investigation means they go look at it. Many times it will involve taking it out or taking out a piece of it to look at it to tell you if it's a lymphoma or not.
Okay.
And then the third one are the cancers of the muscle. Muscles arises anywhere in the body. So those ones could be on the face, swelling. It could be in the neck. It could be also in the abdomen, swelling in the abdomen. It could be on the leg, on the hand. It could be a swelling. So all
Anything that is a
swelling,
swelling or a mass in any part of the body,
yeah,
high
should be looked
suspicious of a cancer.
You
So
should
if
look
it's in the
at it.
stomach, could indicate kidney. If it is in the armpits or in the neck or in the groin area,
Could
those
be
could
a
be swollen
lymphoma.
lymph nodes, suggesting lymphoma. Or
Exactly.
if it is just anywhere in the muscle, under the skin.
It should be looked into, and at least let it be looked at nicely by somebody who is qualified. And if they tell you that it is nothing, seek further attention
To seek a second opinion.
to make sure that, because usually a lot of the parents I see who come to us at the Cancer Institute, in all fairness, have not been sitting at home. There is usually a very nice history. They went somewhere and they were told it's nothing. You go back home, come back in 2 months, and they went home and they believed the health workers. So I think that's the other message as parents: to be vigilant. Seek the next, because something is wrong if there is a lump. A lump should not be there. And if you live in and around the Kampala area, come to the Cancer Institute. We are more than able, at no charge, to investigate things like those. If you're worried, you walk in, we are able to arrange for a biopsy to be taken. That's a small piece of tissue, and then get it looked at in the proper channels so that you can get your treatment the way you need it to be gotten.
So the final question would be, are these cancers also curable?
Yes, they're highly curable as well, and we have the treatment. Wilms tumor is very highly curable, sometimes as much as 90%, in the excess of 90%.
That is a kidney, the
Yes,
tumor
the
of the
kidney.
kidney.
Yeah, kidney with chemotherapy, surgery, and radiotherapy, all of which we have available at the UCI at no cost. If it's cancer, rhabdomyosarcoma of the muscle, again, it's also curable. Lymphomas are also highly curable. So really cancers in children, and that is the message, as opposed to adults. Cancers of the children are highly curable, even when they present in fairly advanced disease stage. The hope is not lost. So I don't want you to sit there and say, this is already stage 3, I'm not going to bother. Because even with stage 3, the cure rates are still considerable.
With the advanced stages of the cancer.
Yeah.
There's still something to save. Okay, so
You are watching the DocTalk Show.
and in as much as we are faced with the burden of non-communicable diseases, remember we still have infections to deal with. And in Uganda, one of the most common infections that's disturbing so many children especially is malaria. So have a listen to our doctor, Dr. Myas Lugemwa, giving you tips on how to prevent malaria.